Is your price point pushing patients away? Balancing fair pricing with quality tools, training, and tech is no small feat.
The question is ethics of regenerative medicine pricing. How do you ensure accessibility without sacrificing quality?
Watch to learn how top doctors navigate this ethical crossroad.
How do you ensure that those people who can't pay because it's not covered by their insurance can actually have access? How are you solving that problem of equity in your practice?
There's always those ethics of, as you said, accessibility versus quality of care, just being able to do it. And the price, and sometimes high price, can limit access for lower income patients. And so there's concerns raised about healthcare equity. So there's several ways that you can do it, and I do it in the clinic. So number one is you can offer payment plans, and that can make it easier for them to swallow if they pay little chunks every month or so. So that's something that you can look up. There's several ways of doing that. And so I'm researching the best payment plan that I want to integrate, because the ones that we used before I don't necessarily love so much. But that's one way. Number two would be to maybe have like a tiered pricing and offering some sort of discounts for patients who have probably do it as a booster shot. This is the second time they're doing it on the same body region. Then you can have either a discount pricing or a package pricing. And another way, and which I have done and enjoyed in the past, is to do like partner with some organizations. Like I participated in warrior to warrior programs wherein we do pro bono work for the military servicemen, and see whatever your practice can accommodate, maybe 1 or 2 a month, have like a pro bono day, and just kind of partner with organizations like that, or veterans in pain, and help like that.
Don't forget, if you want more about the business of orthobiologics, I have a podcast, or you can go on my website, the business of orthobiologics, and tune in.
Another thing that you can do is to do maybe like at certain times of the year, do significant discounted rates on, for, again, in the same topic, because I'm in San Diego, so we do have a lot of veterans. So let's say a Veterans Day, do like a significantly discounted rate for people in the military. Or Thanksgiving Day, do again like a program or a promo with significant discounts for patients who you feel will benefit most from the treatment. And so there's several ways that you can do it, such that you can still incorporate like an ethical business model that can include compassionate pricing or service to people that you think will benefit. I mean, at some point, there has to be some cost-sharing initiatives if we want to make this like a bigger program. At some point, I think the government or some other nonprofit funding should be incorporated to help subsidize regenerative medicine for wider use. But yeah, there's always this balance of innovation and accessibility that's kind of hard to do. But that's how I would think we in the private practice can do it in our simple ways.
Yeah.
Cost is always hard topic.
I know. I've actually incorporated a patient-driven scholarship fund, and we offer everybody who is already paying for these procedures at their follow-up. We just let them know that we have a scholarship for those who may not be able to afford it, and would they like to contribute. And then when we have those patients who would benefit from it but just absolutely cannot afford it, then we take the scholarship and we apply it to the patient bill. And if it doesn't quite cover, then, that's where we just make a donation from ours, like a matching donate from the clinic.
Yeah. And that's the fun thing in private practice. You can be creative in any way that you can with regards to helping patients. There's several ways that you can do it. At the same time, patients understand that there's a cost to high quality care. And that's the reason why a lot of patients are doing concierge medicine as their primary care providers, or direct specialty care, because they do understand that you get what you pay kind of deal.
More now than ever, I think.
More now than ever, for sure. Yeah. And your prices will reflect this. Like, for example, I invested in a lot of different equipments to make sure that I get the best outcomes to justify my costs, right? I invested in a cell counter. That way I know exactly how much I'm delivering to my patients and improve their outcomes. I invested in a biosafety cabinet or a laminar hood so that I know that everything is done in a sterile, clean environment. I invested in a fluoroscopy machine and an ultrasound machine so that everything is precise in the delivery of the cells. And then there's also staff training, and there's also your continued education. So all of this will help you get to a better outcome, which will translate to that cost that the patients paid. If they have better outcome, then they will be happy for the service that you provided for them.
don't miss out. Please subscribe to our newsletter now to stay ahead of the world of orthobiologics. You can find the link below. Additionally, if you're ready to start this journey with me in my Orthobiologics Masterclass, come join us.